From the San Francisco Public Press, you're listening to Civic. Social Security. It's one of the most trusted institutions in American life. In San Francisco, more than 100,000 people rely on those monthly checks, often for basics and a measure of dignity.
It keeps me breathing, my Social Security.
But holes are appearing in that safety net as the Trump administration makes sweeping changes, all of which are leaving vulnerable people struggling to access essential benefits.
He's in great distress about whether or not he's going to be able to pay his rent.
Meanwhile, the shrinking workforce is already straining under increased workloads,
causing people to get ill. One of our reps had a stroke. He's in the hospital.
Today, we'll hear from recipients, advocates, frontline workers, and lawmakers about the growing challenges inside the Social Security system. I'm Sylvia Sturm, and this is Civic. While creating this episode, I found myself reflecting on what it means to wait, not just in line, but in fear. I imagined how it would feel to work my whole life and pay into Social Security, with the promise that I'd be taken care of when I couldn't work anymore. And then, what if one day that crucial support didn't show up? Phone lines are jammed, my local office is closed, there's no one to turn to for answers. That's not a distant fear. It's the everyday experience for a growing number of Americans who depend on Social Security for retirement, disability, or survivor benefits. Their lifelines are under threat, not because the money's gone, but because of how the system is being administered. Since January, more than 7,000 employees at the Social Security Administration have been laid off, reassigned, or have left voluntarily through buyouts or early retirement programs. And many more are expected to leave in the coming months. The upheaval has been initiated by the newly formed Department of Government Efficiency, or DOGE. The Center on Budget and Policy Priorities called the cuts aggressive and warned that they threatened to disrupt services. But, according to Commerce Secretary Howard Lutnick, a missed check is no big deal for recipients. In fact, he said it would be suspicious if they complained. Here he is during an interview on the All In podcast.
Let's say Social Security didn't send out their checks this month. My mother-in-law, who's 94, she wouldn't call and complain. She just wouldn't. She'd think something got messed up, and she'll get it next month. A fraudster always makes the loudest noise, screaming, yelling, and complaining.
California Senator Adam Schiff immediately pushed back on Lutnick's narrative.
That's absurd. For millions of Americans, Social Security is it. And if they miss a check, it matters big time. It means they can't pay their rent or they can't pay for their medicine. It is not some frill.
Kelly Dearman heads Disability and Aging Services at the San Francisco Human Services Agency. During a roundtable discussion hosted by House Speaker Emerita Nancy Pelosi in San Francisco last April, she described what the support means for more than 100,000 people who rely on the benefits.
Nearly a quarter of all San Franciscans receive Social Security income. If these folks' foundational support are cut, it would be difficult for them to even make it at all.
A few of them joined Pelosi's roundtable to talk about their fears over losing the crucial support.
It keeps me breathing, my Social Security.
It pays for my rent. It pays for food. I mean, where is he going to take us? I mean, we can't pay our rent. I'll be on the sidewalk.
The second Trump administration has ushered in some of the most significant and brutal changes the Social Security Administration has seen in years. Thousands of staff positions have been slashed. Offices are closing, even though stricter ID rules require people to appear in person. Phone verification is no longer an option for most retirement and survivor benefit applications. Meanwhile, the agency is rolling out an AI-powered phone system, and there's been a major push to move more interactions online. But the upgrades in technology haven't made up for the loss of people who used to engage with recipients personally. Workers now report overwhelming caseloads, long backlogs, and growing delays in customer service, even though Americans are paying more than ever into Social Security. The country's workforce generates $1.2 trillion per year in payroll taxes split between employer and employee. That makes Social Security one of the largest and most stable public programs in the country. In addition to managing retirement benefits, the agency distributes payments to survivors of workers who paid into the system, as well as supplemental security income for people with disabilities and people with a very low income. And it's really efficient. The cost to operate offices, manage cases, maintain systems, and serve the public is capped at just a fraction of 1% of the program's total spending. In other words, less than 1 penny of every dollar collected in payroll taxes is allocated to operations and staffing. The rest goes directly to paying benefits. That operational budget comes from annual funding approved by Congress, and it's been cut by about 17% over the past 10 years when you account for inflation. These cuts have had consequences. The average disability claim takes about 7 months for an initial decision, and over 2 years if appealed. Paul Aguilar knows the cost of those notoriously long delays. He's a San Francisco resident and long-term HIV survivor. The medication he was given decades ago kept him alive, but also left him dependent on disability insurance.
Long-term survivors develop cognitive issues 10 to 15 years sooner. Normal heart disease in aging people have developed in long-term survivors 10 to 15 years sooner. Cancers that normally attack people in their 80s are showing up in long-term survivors 10 to 15 years sooner. Liver disease, issues from the meds that we've been on that tore our bodies apart. AZT was hell. All of those impact my ability to work a full-time job. There's no way I can work a full-time job.
Over several decades, Aguilar worked part-time when his health permitted. He's always diligently reported his income, and the Social Security Administration reduced his benefits accordingly. But last March, he received a notice that he owed the agency more than $200,000 because he made too much during 1 month in 2013. That overpayment retroactively canceled every payment he's received since then. Now his Medicare and disability benefits have been cut off, and he's waiting for a hearing on his appeal, which could take several months or maybe even years. He has no way of knowing.
I'm on long-acting injectables, and they cost about $3,000 a month out of pocket if I don't have insurance. And that's just that. They just refused. Okay, so I broke my wrist in April. 4 visits about my wrist. I now have a bill for $32,000 because they won't pay it because according to the records, I don't have Medicare. I have Medi-Cal, emergency Medi-Cal, but Medi-Cal only covers about 20%. So here I am with these bills piling up. It's crazy. It's just crazy.
Aguilar's physician, Monica Gandhi, said this isn't just a paperwork error, it's a threat to his life.
He's doing well only because he's on highly specialized HIV therapy that we can access through his insurance. And so I was really heartened by how his health was going. And then this happened. There really isn't a way for any clinic, any healthcare center to provide medical care and to purchase these medicines and give them for free. That isn't something that we or any other clinic has an ability to do. We rely on health insurance. So I've been really worried about it and am extremely concerned. Essentially, the natural course, if he was unable to stay on HIV therapy, the natural course is unfortunately morbidity and mortality, getting opportunistic infections and dying.
Despite facing terrifying prospects, Aguilar maintains optimism and gratitude for the help he is receiving.
I have the subsidy from Catholic Charities, which helps with my rent. I have the food stamps. And I guess just the kindness of strangers. I've been very fortunate. I'm going to be okay no matter what. I don't need much. I need a roof over my head, clothes on my back, and food in my stomach. I've been battling AIDS since I was 18. So this is this is just one of those things.
Meanwhile, he won't stop fighting to improve the system.
My dad taught me this. He always raised me with this philosophy. If there is an injustice happening and you say nothing or do nothing to change it, you are just as guilty as the person perpetrating it. And I've lived my life that way. If nothing else occurs from this other than people are more aware of the intricacies and how convoluted the Social Security system is.
After posting his story on Facebook, Aguilar was contacted by staffers for both Schiff and Pelosi.
There's really not a lot they can do, but they can at least put an inquiry into Social Security.
During her April roundtable in San Francisco, Pelosi said it was important to keep talking about the threats to the agency.
What's so sad about what's happening now is they'll say, we're not touching benefits, but they're closing offices, they're shutting down the phones. People have to know. So we just have to have a drumbeat, a constant drumbeat of this is what they are doing.
Local legal aid firms are inundated with calls for help from people struggling to access or maintain their benefits. And even these legal experts are having a hard time getting answers for their clients. Joanna Parnes, managing attorney for Bay Area Legal, describes one of her clients' difficulties.
He ended up with an overpayment because there was a lag in when he reported his income. Then he received a very sort of confusing, opaque notice from the Social Security Administration indicating that starting in July, they were going to start withholding $200 a month as opposed to $20 per month. And the notice did not explain why. So we called multiple times. Each time we were on hold for about 20 minutes, and then our call was dropped. And meanwhile, he's in great distress about whether or not he's going to be able to pay his rent. Like many of our clients, he doesn't have anything left at the end of the month. Every dollar is accounted for. And so the difference between paying Social Security back $20 per month and $200 per month is essentially the loss of $180 in income, which for somebody with nothing left at the end of the month is not feasible.
Much of this turmoil is being driven by a long-standing far-right philosophy that focuses on supposed fraud and government inefficiency. In his 2025 State of the Union address, Donald Trump leaned hard into claims of massive fraud.
Believe it or not, government databases list 4.7 million Social Security members from people aged 100 to 109 years old. It lists 3.6 million people from ages 110 to 119. I don't know any of them. I know some people that are rather elderly, but not quite that elderly. 3.47 million people from ages 120 to 129. 3.9 million people from ages 130 to 139. 3.5 million people from ages 140 to 149. And money is being paid to many of them.
The implication? That the system is riddled with swindlers and scammers, and that drastic action is needed. But fact-checkers and agency veterans say this is totally false. Jacqueline Hopkins has worked at a Social Security office in Richmond for over a decade, so I asked her about this fallacy.
They haven't uncovered anything. They really had a hard time reviewing the data because they didn't have the expertise. And so they were making outlandish commentary about what they found. I think Social Security has for years been extremely judicious in making sure that our records are accurate, or as accurate as can be.
It's true. According to the administration's own actuarial reports, fewer than 90,000 beneficiaries were aged 99 or older last year, not the millions Trump claimed. That's less than 1% of total recipients. Independent analysis, including by the Washington Post, confirmed that many of the inflated figures come from archived or inactive data entries, not active payments. Workers explain that these so-called zombie beneficiaries are the result of legacy coding issues in 1970s-era computer systems, not proof of rampant fraud. And according to last year's audit by the agency's own Office of the Inspector General, improper payment rates were below 1%. Only a fraction of that fraction was actually fraud. Most errors were administrative or reporting mistakes. Schiff and other lawmakers argue the real risk isn't fraud, it's the damage caused by spreading false allegations.
So this is all part of a plan, and that is make it difficult for people to get checks, maybe cut off their checks, make it hard for people to call, make it hard for people to visit a Social Security office, and then to complain Social Security is not working. It's not working. People can't get through to Social Security. People aren't getting their checks like they're supposed to. It's not reliable. Their whole goal is to see if they can damage the system, cause distrust in the system, with the eye towards privatizing the system, because that's where these people come from. So what happens if they privatize it? Well, that means they take the money from Social Security and they put it in a market. Maybe they invest it with their wealthy brokers so that they can take some money off the top. They invest it in the market, and that helps the shareholders, which is a lot of those wealthy billionaires. If the market goes up, great. If the market goes down, well, you lose.
To grasp how sharply the Trump administration's approach diverges from Social Security's original mission, it helps to look back at how the program began. The Social Security Administration was born out of crisis. In 1934, amid the Great Depression, President Franklin D. Roosevelt signed the Social Security Act into law.
The civilization of the past 100 years, with its startling industrial changes, has tended more and more to make life insecure. Young people have come to wonder what would be their lot when they came to old age. The man with a job has wondered how long the job would last. We can never insure 100% of the population against 100% of the hazards and vicissitudes of life, but we have tried to frame a law which will give some measure of protection to the average citizen and to his family against the loss of a job and against poverty-stricken old age. It seems to me that if the Senate and the House of Representatives in this long and arduous session had done nothing more than pass this security bill, Social Security Act, the session would be regarded as historic for all time.
It was one of the most ambitious anti-poverty programs in U.S. history, promising economic security for the elderly, disabled, and survivors of deceased workers. Back in 1967, the Social Security Administration was serving about 30 million people with a workforce of about 82,000. That's roughly 350 beneficiaries for every employee. Even as the agency took on major new responsibilities, like rolling out Medicare and launching supplemental security income in the early 70s, it managed to keep pace. Over the decades, the agency saw several major shifts. In 1983, Congress responded to a funding crisis with sweeping reforms, taxing some benefits for the first time, covering federal workers under Social Security, and gradually raising the full retirement age to 67 by 2027. By 1989, the agency launched a national 800 number, centralizing phone services and allowing people to schedule claims appointments by phone. And by the mid-2010s, the agency was steadily offering more services online. Today, Social Security touches the lives of 1 in 5 Americans. It serves more than 71 million beneficiaries, with fewer than 56,000 employees. That equates to over 1,260 beneficiaries per employee, more than triple the 1967 ratio. Digital advancements have allowed administrators to become more efficient over the years, but workers say staff reductions have already gone too far as the agency shrinks its presence across the country, including in San Francisco. Here's Sylvia Norman, president of the union representing administration staff across Northern and Central California.
We've fought to save offices in San Francisco for years, and because we've had Hunters Point that was closed. We had Parkside that was closed. They're moving Mission, and I don't know what they're going to do with that. We're talking about a city as big as San Francisco with only 3 offices now, and you have a city as small as Fresno with 3 offices. So something's wrong with that picture.
Workers say the mass exodus over the past several months is a result of pressure by DOGE. They say that the department's demands seem deliberately designed to drive them out, like a new rule that says employees have to email DOGE a list of 5 things they've accomplished each week. Jacqueline Hopkins and Sylvia Norman talked about the pressure campaign.
I had one rep that asked for a receipt when he sent the email, and nobody ever reads it. No, they don't open it up. They don't look at it. It's just a busy work.
Now they're told, you're 1 minute late, so you have to 8 o'clock, you're 8:01, you have to take the 15 minutes of leave. So they're eating your leave, and then you build up 3 lates, and you get an occurrence, and an occurrence, 3 occurrences, then you get suspended. They're just trying to get people out the door the easiest way they can, and they can base it on attendance and performance.
For some reason now they think that the federal employee is the problem. Those employees are given their heart, soul to seeing that the job is done and done well.
We are the front line. We're protecting the customers, the claimants, the beneficiaries all the time. When we get introduced new policy or something, we ask, how does this affect the people we're going to serve? No, this is not going to be good, or you're asking too much of them, or,
Right.
And we're their secret voice, in the office as well. All of us employees are.
Right. I mean, I have management pretty almost crying on your shoulder about some of the things that they're being told they have to do that they don't want to do, that they feel is not right. And the way that they feel that their employees are being treated, and that they feel is causing more pressure than necessary, causing people to get ill. I mean, to have to take off and ill. I had one of our reps, as a matter of fact, Jackie, had a stroke. He's in the hospital.
Oh, no.
Yeah. They know for a fact Social Security is understaffed. It says it's never been this low staff in 50 years. So in the meantime, you're pushing these folks out of the door. You're asking them to retire or to quit, and we'll give you X amount of dollars. And they know the staff is already low.
The understaffing has had dire consequences. In 2022, the Office of the Inspector General reported that more than 10,000 Americans died while waiting for disability benefit determinations. Joanna Parnes explained.
We also have had clients who have died during the wait time during this process. Many of our clients, this is a benefit program for disabled folks, and some of them have conditions that they have died from while they are undergoing this really lengthy process. And I am concerned that will continue and increase.
Frank Bisignano, a former banking executive with no prior experience in public benefits, became the Social Security Commissioner in May. Trump's pick to oversee the agency made it clear that he plans to keep staffing levels low and push for automation.
Our fiscal 2026 funding request allows us to invest in our technology strategy to provide customers with digital and automated options as they experience regularly in their daily lives. I've heard from some that our performance is not acceptable, and we need to hire more staff to improve. I do agree, we must perform significantly better. But increased staffing is not the long-term solution.
The shift to digital-only access is creating serious barriers for millions of people who depend on in-person help, especially those who aren't tech-savvy or don't have reliable internet.
And that is just not realistic for the vast majority of the clients that we see at Bay Area Legal Aid. A lot of our folks maybe aren't tech-savvy. They aren't adept at sort of navigating various government websites that can be opaque or confusing to use. Some folks don't have access to, or at least reliable access to a computer or a smartphone. So that is just not very realistic.
Laura Chiera, head of legal aid for the elderly in San Francisco, agreed.
Obviously, some seniors are tech savvy, but most honestly have a really hard time. And they're getting attacked by scammers on every single front. We had a case where someone said that they were from Wells Fargo and was part of like a secret investigation because they know that people were stealing. You know, it seems like a fanciful story right now, but when they're pressuring you, like, we need to make these, they're taking your money right now. We need to get you right now, you know, all these things. It just, you know, you're just confused, right? Anybody would be confused. And, you know, and these are professionals. They get PhDs in scamming people. Like that's all they do is scam people. So the more you move all these services online, that's what happens.
The agency once prided itself on being a public-facing institution with field offices at the heart of communities. But with AI tools replacing people and performance metrics tightening, many workers say the mission feels lost. Jacqueline Hopkins and Sylvia Norman say the inability to properly serve the public weighs heavily on their colleagues.
We used to be a country that cared about people feeling a part of this country, and now we've isolated ourselves.
Maybe being here, employees at Social Security, we're right at the crossroads, and we're seeing it in action. And we know there are really people out there that really, really need this. You know, it sounds...
They need help. They need help.
You know, but you are not sitting across the table from, you know, a mom who just lost her husband and she has 3 small kids and she didn't work and he was the only one who worked. So all they got is the survivor benefits. That's it. Dad paid into that for them and they're proud to. Every month they say, I get a check from my dad. It's an act of love even after they're gone. We all know we could be sitting on the other side of that desk. This is the heart and backbone of a civilized society. Is Social Security helping us as we get older or as we're not able to help ourselves?
It's not just an entitlement program. This is something that belongs to them, really. And it belongs to all of those that are working or have worked.
California Attorney General Rob Bonta is fighting the upheaval at the Social Security Administration. On April 2nd, he joined a coalition of 21 attorneys general in filing a lawsuit that challenges the abrupt changes to core Social Security policies. The suit argues that chaotic staffing cuts, field office closures, and shuttering of departments have undermined the agency's ability to serve Americans effectively. A judge denied a preliminary injunction to halt the Trump administration's actions, but the lawsuit continues. Meanwhile, the California Department of Justice is encouraging Californians to fill out an online complaint form whenever they experience problems with the agency. The form lets people report problems like missing or late benefit checks or the inability to reach agency staff by phone, online, or in person. While the AG's office can't resolve individual cases, submissions help them track widespread issues and potentially pursue future legal action. Anyone who's experienced problems with Social Security can fill out the form at oag.ca.gov/Social Security. We'll post the link in our show notes. Social Security was created to provide stability, dignity, and care to those most in need. But today, those who access or deliver the support are issuing a warning. It's coming apart. Civic comes to you from KSFP LP 102.5 FM in San Francisco, a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find the accompanying article for this episode and all our reporting at sfpublicpress.org. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Our team includes KSFP Program Director Mel Baker and Executive Director Lila LaHood. Civic airs Tuesdays and Thursdays at 8 a.m. and 6 p.m. on KSFP. I'm Sylvie Sturm. Thanks for listening.